My name is Dr. Dennis Nagata. I've been in dentistry for 30 years. I started dentistry because of my mom. My mom was a dental assistant at the Schofield Dental Clinic, and there I was introduced to the profession, and it intrigued me. I went to school here locally at Iolani School, and during that process I focused my energy on science, and then I graduated, and then I attended the University of Hawaii for 2 years, again focusing on a biological degree as a major. However, Hawaii did not have a dental school at that time. So what I evolved is I moved to California and got accepted to the University of Southern California Dental School. Dentistry is important so that we can eat, smile, and express ourselves in a pleasant way. When you see someone without teeth or with discolored teeth, it's very noticeable, and your eyes go straight to that distraction.
What is a root canal?
A root canal is a procedure that's done for teeth that have been infected due to tooth decay. So what has happened is the decay has progressed deep into the tooth, into the nerve chamber, and the bacteria has infected the nerve chamber. As a result, we have to treat the inside part of the tooth with a root canal procedure. We take out the infection, fill it in with some material that will help the tooth heal, and you can save that tooth and keep it for the rest of your life.
What is the difference between the silver and white fillings?
There's two different materials that are available to fill teeth with. In the past, we've used silver mercury fillings to fill teeth. But today's technology and today's science, we've developed tooth-colored restorations that are much more biocompatible to the human body. As a result, we're recommending the use of biocompatible materials at this time. However, silver mercury is still a viable restoration for people who have the need for a filling, but it essentially is a patient's choice, but we can be a lot more conservative with the white filling.
Throughout our life as we age, how does our dental care change? Do we need to go to the dentist more often? Is there things we can do at home to help with our dental care?
As a person ages, we find that the gums recede with time. And due to the gum recession, older people start to experience a little bit of sensitivity because the roots are getting exposed. Sometimes because of any gum disease or something like that, we find that the older generation starts getting teeth that are loosening up. So it's not common for you to lose teeth just because you get old. It's just a matter of proper care and prevention before you reach that senior time so that you can prevent yourself from getting dental problems.
Diabetes and heart disease are kind of prevalent in my family. I was wondering, is there any extra care that a person has to do to take care of their teeth, especially if they are diagnosed with diabetes or any heart issues, or is it just same basic maintenance care as someone without the same diseases?
Science has established a link between the bacteria that's in the mouth that causes gum disease to potentially affect people who have heart disease and diabetes. The bacteria will travel through your blood supply, through all your vessels, if you have gum disease, and potentially affect people who have heart disease and worsen the symptoms of heart disease as well as diabetes. And often we can see in the gums when there's a problem and there's a bacterial infection, and there's often a correlation between the three. So it's important that the people keep their teeth clean so that we don't, especially if they have some kind of disease like heart disease or diabetes.
I'm a young person, and I know a lot of young people my age have like lip piercings and tongue piercings, and even some young people are getting grills, the gold cap things that you get on your teeth that rappers often wear. Is that, really dangerous to our teeth or have any major negative effects?
It's a lifestyle choice. However, it can affect the teeth. I've seen teeth that are chipped and cracked because of these piercings. You see a lot of these tongue piercings, and if for some reason they fall in a wrong way, that device may crack the teeth, and I've already seen that, and you talked about grilling, the grills in front, and they put artificial devices on the front of the teeth. If you ever get hit in the mouth or whatever, the sharpness of the device may cut the lip. So if you do have those things, you have to be very careful in what you do around your mouth.
And flossing, really every day? Really?
As far as general care in dentistry for the person, I believe that the person should go to the dentist at least twice a year for cleaning, examinations, and necessary x-rays. At home, make sure you brush twice a day and floss daily. That's the key.